Hey everyone, hope everybody's doing well. I'm going to record this lesson for our health class on mental illness awareness. Okay, as we know, somebody that might have a mental illness might not be seeing things very clearly. So evaluating one's mental health is very important. Okay, and it's something you can do regularly, whether you're mentally ill or not. Stress, all sorts of things can cause us to get mentally ill. So patients who regularly contact their doctors are more likely to receive correct diagnosis as signs of mental illness emerge. Okay, so again, this goes back to the previous lesson on when you're getting your regular healthcare checks, doctors might be able to notice something's up. You could be having severe weight loss or eating issues, and it could all lead up to an underlying mental illness. A correct diagnosis depends upon patients being honest, okay, with your doctors about the symptoms that you're experiencing. So I know a lot of people get afraid to admit when they're experiencing these mental illness symptoms, but you shouldn't have a sense of shame. You should just, do what you can to get help, okay? Be honest with your doctors or any other medical professionals. Like all medical problems, regular treatment can go a long way towards allowing an individual to effectively manage a mental illness. So when talking about mental illness, there are three big mental illnesses, and you might have heard of these before. The first one being clinical depression. So it involves a chemical imbalance in the brain. Stress and trauma can bring on symptoms of clinical depression. Bipolar disorder. Okay, these are periods of being in an elevated mood followed by depression. So, we all have our highs and lows, but these are extreme. So some symptoms such as speaking very rapidly and intensely focusing on an activity, or the inability to sleep could be signs of bipolar disorder. And then the third one, schizophrenia. It's marked by symptoms such as hearing voices in one's head, seeing things that aren't there. It's also hard for those suffering with schizophrenia to interact socially with others, okay? Those with mental illnesses may have a hard time seeing it in themselves, so it might take a close friend or family member to recognize the behaviors associated with mental illness. So, hopefully you have people in your life that take note of this stuff, and if they see some changes, they can let you know and help you seek the help that you might need from a professional. So when it comes to managing mental illness, of course, therapists can help with any problems that an individual may have. And remember, mental illnesses range from mild to severe. So the kind of treatment required depends on the intensity of the given illness, okay? Mental illness also gets worse the longer it's untreated, just like any other type of illness or disease that may go on in the body. So it's very important that someone with symptoms gets care immediately. Mental health is an important part of staying healthy, even if there's no mental illness involved. So, every day you should be taking care of yourself, not only physically, but mentally. You've probably heard that before. So everyday factors such as stress can put the mind's ability to function and take the role on the body. So as you know, we're all living in a pretty stressful, different time right now. So it's important to take time for yourself, meditate a little bit, use some sort of relaxation techniques, exercise and work out. Those all help clear the mind and body. Healthy relationships is also essential to have. So you want to have those positive people in your life, okay? Sometimes people we care about deeply and are devoted to, sometimes we have unhealthy patterns within those relationships. So just make sure your relationships, whether it's with your parents, a significant other, friends, are positive, healthy relationships. We all definitely have those moments where we have those extreme highs and some of those low moments in our life, but it's important to take care of yourself mentally. Find what works for you. And remember, we're each different. We think differently, we're built differently, although we have virtually some of the same parts. We're not all wired exactly the same. So what works for somebody might not work for you. So find what works for you, works best for you. And people may judge what you do to take care of yourself, You know, don't let that happen. If it works for you and it makes you happy and it takes that stress away, then do it. As you continue to grow, you'll begin to understand your body and what you need personally. So just like I said before, do what's best for you and go with it. And if you need additional help, don't be afraid to seek it. Reach out to your parents, your friends, or a healthcare provider so that they can get you on the right path that you may need. That wraps up today's lesson. Short, sweet, try to make them short and sweet and just summarize what's going on in the readings. Remember, if you need any help at all, hit me up with a message on PLP, email me. I need you to log into class every single day, whether you do the work right then or not. I just need you to click on the health course, look at what's going on there, click out of it. As soon as you log in, I can see that you were active on my screen. I can mark you for attendance, and you need to do that for every class, just not my class, okay? If you want to work on health on Mondays and Wednesdays, great. Just make sure you're also on track, but I need you to click into my class Monday, Tuesday, Wednesday, and Thursday. Have a great one, everyone.